views and opinions expressed in this program are those of the participants and do not necessarily reflect the views of BronxNet or the program underwriters.
Hi, welcome to Today's Verdict, the live and interactive show that brings you your legal rights and options. I'm your host and trial attorney, David Lesch. As you can see, for the first time while filming for BronxNet, I am not in a suit and tie, and the reason for that is I am working from home, just like most of us in New York because of the coronavirus. But the show must go on, and our viewers have been emailing me with topics. And today's topic, we're going to be discussing immigration status and how those who are undocumented have been affected by COVID-19, specifically those who are afraid to get medical treatment, as well as those who have expiring H-1 visas or who actually may have been furloughed and told to collect some type of unemployment, and whether or not they can stay in this country as a result. We have two wonderful guests who will be joining us. So of course, we have a lot to get to, so stay tuned. Today's verdict starts right now. Lymari, how are you doing today?
I am doing good within the circumstances, yes.
Are you staying safe? A lot of social distancing?
Absolutely.
All right, so there's a forgotten group, I think, in this whole coronavirus epidemic, and I believe those are the undocumented. Some of them, we're talking about some of those who actually do have H-1 visas and aren't documented, but let's start first with the undocumented that are in the detention centers throughout the city. There has been a suggestion, at least, that they're not getting the best treatment. There's been some overcrowding. What have you heard on your end with respect to the immigration field?
In the New York City area, in New York City per se, we don't have detention centers for immigration. So our detainees the ICE detainees get detained in New Jersey. There is one specific detention center that it's run by ICE, which is the Elizabeth Detention Center, and then ICE also has contracts with New Jersey, and they house other immigrants in Essex Correctional Center, in Hudson, and in Bergen County. So it is my understanding that a detainee at the Elizabeth Detention Center tested positive for COVID-19. And it's my understanding, I go to these jails to make visits to these inmates. And it's my understanding from my bar, from the lawyers that work with me, that they're not allowing contact visits, but you still have to provide your own mask or anything that you want to protect yourself in order to go and visit these inmates.
I've been reading a few articles that some of the centers, that those who are running the centers are not wearing masks, possibly exposing the detainees, who, by the way, are in a very crowded area. So you think there would be an outbreak very easily.
Absolutely, absolutely. And in fact, there right now, there's at least 2 federal lawsuits that have been brought by the family members of some inmates that are in these conditions. And it's important to understand, I mean, in places like Elizabeth Detention Center, the inmates that are there are not there because they violated a crime. They committed a crime. They are there because they are here undocumented. So these are not, like I said, people that have been convicted of a crime. They're criminals. They're just detained because they're here undocumented. So there's really no harm to the public in if they release these undocumented immigrants, and especially in these times when they should be with their families and protected in general.
Does it seem like that's something that may actually happen, releasing them, or no?
And many non-for-profit organizations and my bar, again, the immigration lawyers, are petitioning the government very aggressively to please release these people that are, for no reason, they need to be there in these times. So hopefully the government will listen and they will release people before it's too late.
You know, I know when there was the measles epidemic, a lot of the detainees, unfortunately, were affected. And again, because they were very close quarters. And I'm hoping they learned their lesson this time, but I guess only time will tell.
Absolutely. But it's
Let's shift gears a little bit.
And because of the very aggressive efforts of this administration to detain people that are undocumented, like you said, these detention centers are overcrowded. So they're at max capacity. So that's a very dangerous situation when you need to be maintaining 6 feet of distance between people to avoid spread.
Absolutely. Let's switch gears a second. Let's switch gears a second to some of the employees who are working. So they are documented. They're under the H-1 visas. But I understand on March 18th, 2020, the Department of State was suspending routine visa services in most countries worldwide. So you can't get here and we can't get out. What about those who are working here already on the H-1B visas? What happens to them with respect to either furloughs or working from home? Have you heard any issues about that?
I haven't heard specifically to that. I know that in the cases of students, for example, who are here on an F1 visa or a M visa, they have advised the schools where they are at that they can't, if they're suspending the schools because they have to by whatever order that's the location of that school is, they are not going to be penalized, but they need to inform, these schools need to inform the government of their policies and what they're doing. And if they are offering, for example, online classes. So it's not like, okay, we give you a break and that's it, we're all good. So they still have to report that they're still in business at least, and that they will pick up where they left once this is over. But they can just not go and say, okay, this is what's happening. So, but they're trying, the government is trying to make accommodations, obviously, because people, this is beyond people's control. So I imagine in the H-1B visa field is the same.
Can I ask you a question? How would they go about doing that? Is there somebody that they're supposed to actually be contacting in terms of offices? I mean, do they do it online? Does you have any information about that? How would they go about letting the government know?
So yes, so for schools, they have a specific office that they deal with immigration, and I understand that they could do it by calling them or emailing them and using the service system, which is the system that specifically is designed for schools. So the immigration offices are open; they're just not open to the public.
Okay.
Now, if a specific immigration office is in a location where they have a complete shutdown, and that's a different story. But as of now, the offices are still open.
All right. We don't have too much time left, but maybe some tips that you might want to give our viewers with respect to this COVID-19 and how they should protect their own status or whatever they would really need to do. What would you be telling your clients? What would you be telling the community who's watching right now?
So we know that ICE has suspended arrest unless in for very dangerous individuals. So they have suspended overwide arrests. also, I think that people need to understand that that the immigration courts are still open for detained cases. Deadlines are still in effect. So even though they're not necessarily open to the public, the same thing with the immigration service, they're still open. So if you do receive a letter from immigration, you cannot ignore it. If you receive a letter that says that you have an appointment in the future, maybe not in the next weeks because the courts are closed to the public, you still have to contact an attorney. Do not ignore it. These regulations and the way they're going about it, the government is changing every day. One day they close a court for fighting, another day they open it again, and they're being very strict. They're saying that you still should meet your deadlines. And so if you do have, did you receive a denial recently? Did you receive any correspondence? Take it seriously still, and contact an immigration attorney. Don't ignore it because it can have consequences against your status.
Well, Lymari, we really appreciate it here. And of course, please stay safe.
You too.
And the next time we see you, hopefully, we'll be in the studio. And I promise I'll wear a suit this time.
Will do.
All right, you stay safe, okay?
I hope this was helpful. Yes.
All right, that's all for today's verdict. We'll be back with more after this.
School is back in session as families begin a new journey with distance learning. This comes after Mayor Bill de Blasio announced schools would be closed in response to COVID-19, a strain of the novel coronavirus, and many parents were unsure of what this new education model may look like. Founder of nonprofit organization Strive Higher and parent of a 13-year-old, Olga Baez tells us she was initially concerned with the idea of remote learning.
My initial concern was the fact that a lot of low-income students do not have Wi-Fi access at home. Some may not even have computers at home. So that was a big concern.
For Baez, homeschooling her teen wasn't a completely new transition, as Google Classroom was a teaching tool they were familiar with. For parents like founder of Just a BX Mom, Melissa Velasquez, who is also familiar with aspects of homeschool, a New York City distance learning procedure for elementary grade students is very different from what everyday school life is like.
Her actual school time that's designated by DOE, I picked up 4 weeks worth of packets from her school when I picked up our distance learning packet. So she is still writing down stuff for the school. She's answering worksheets. Her time with her teachers is only for a half hour each day. It's her 2 teachers, and 4 of the students? Yeah. And 4 of the students in her allotted time. So it's a small group. They get time. The teachers split up the work that they're doing. One teacher does their wit and wisdom, which is their ELA work, and the other teacher does their math work with them.
And for her daughter, Misa, remote education comes with pros and cons.
I'm missing all my friends, but I like that I have so much free time.
For parents with or without access to resources such as tablets, laptops, and more, distance learning can be challenging. However, Velasquez shares advice for parents that are teaching during this time.
So I think a lot of times parents also feel like they need to know everything, and we don't. It's okay that I don't know this. I'm not the expert in it. And I think that in this time, a lot of parents are feeling like they have to be experts in everything, and we don't. I'm always telling people, go to YouTube. There's somebody else out there that has dealt with this and figured it out. And we're living in a really great time that we have resources like YouTube.
Because of distance learning, many organizations found new ways of teaching and connecting outside of the traditional school structure. Baez shares her organization uses this time to teach the community something new.
We wanted to share with the community something that they can learn and something that maybe it'll be break for them from all the schoolwork and things like that. So we started doing ASL classes online a couple of times a week through Instagram.
The free class meets every Monday, Wednesday, and Friday for children and adults. Strive Higher and Just a BX Mom offer more free tips and resources to help families with kids during this time. Visit @StriveHigherNY on Instagram and justabxmom.com for more information. New York City schools are scheduled to reopen April 20th, 2020 until further notice. Reporting for BronxNet, Kim and Aline.
When taking public transportation, don't touch your phone. Carry hand sanitizer and use it immediately upon leaving the bus or train. Avoid touching your face. If someone is coughing or sneezing, move away. Wash your hands with soap and water as soon as possible. Limit contact with poles. If possible, avoid rush hour. Don't eat or drink on public transportation. Keep your bag off the floor or other surfaces. Avoid directly touching turnstiles. Stay up to date with the latest from your local health department and CDC.
Our BronxNet family wants to inform the community that stress during an infectious disease outbreak can include the following: fear and worry about your own health and the health of your loved ones, changes in sleep or eating patterns, difficulty sleeping or concentrating, worsening of chronic health problems, increased use of alcohol, tobacco, or other drugs. We also want to remind you that there are things you can do to support yourself. For an example, take breaks from watching the news, including social media. Take care of your body by stretching or meditating. Try to eat healthy. Exercise at home. Get plenty of sleep. Make time to unwind. Try to do other activities you enjoy. Connect with others. Talk with people you trust about your concerns and feelings. For more information and tips, you can visit the website cdc.gov.
Today's verdict is a trying times, and luckily we have a few guests who are here to discuss with us recent immigration issues that are affecting all of New Yorkers during the COVID-19 outbreak. And right now we have with us Seongeun Chun, who is going to be discussing a little bit about the public charge rule and law. Ms. Chun, thanks for being here.
Thank you so much for having me.
So first of all, are you staying safe? What have you been doing the last week or two?
All of us at the New York Immigration Coalition, we've been doing our work remotely.
Like the rest of us, I think we have at least another 2-3 weeks of this minimum. So getting used to working from home is something that unfortunately is the new normal. All right, let's talk a little bit about this public charge and really how it affects the undocumented population and what it really means. Most New Yorkers don't understand what public charge is. Could you define that for us, please?
It is a test in certain immigration applications to see if someone is likely to become dependent on the government. And this, application comes into play for green card when you're applying for a green card and certain visas. So this does not apply for when one is applying for citizenship, and it doesn't apply for certain types of visa holders, such as refugees, asylees. But this is only public charge comes into play when one is applying for green card and certain visas.
So let's say somebody comes into the country through whatever particular border, and they end up in New York. How do they apply, or what's the first thing that usually happens? Do they go to a particular office? Does an office contact them? Just can you maybe walk us through it?
This happens when they put in their application to get their green card, and then there's usually an appointment date, and when they go into USCIS office to apply for their application for green card and visas. That's sort of when this public charge test would be considered.
And what are the type of benefits that you might be able to get from the public charge? In other words, that the government would be expected to provide for you?
The public charge benefits is a long-standing rule. So in the past, before February 24th, the long-standing public benefits test, just benefits, are two categories: cash assistance, such as SSI, safety net assistance, and institutionalization for long-term care by Medicaid. That was before February 24th. In the new public charge rule, there's still cash assistance, but then federally funded non-emergency Medicaid is also part of the new public charge rule. And I do want to say that public benefits is only a small sliver of the whole public charge test or rule, which is a totality of circumstances, which takes into consideration one's health status, family size, one's education and skills, income, employment, and certain past public benefits used.
Well, let me ask you a question. So this is, we'll take it a little bit farther at this point. We have, we have this epidemic now, and obviously there are going to be people who are going to need treatment once the whole pandemic is over. Is this covered by the public charge? Will you, or has the February 24th change affected someone's ability to get the proper health care that they may need if they've been sick as a result of the coronavirus?
What the public charge change means is that in 2019, the Trump administration tried to change the public charge rule, but multiple lawsuits stopped the rule from going into effect. The government then requested that the Supreme Court let the rule go into effect. So that's what happened. In relation to COVID-19, we want to make sure that the message is clear, which is that effective public health response, it has to include welcoming message for everyone to seek care that they need. And that means everyone, regardless of immigration status or insurance coverage or income. And
what seems to be the backlash from it? I mean, are you guys making headway here? Does it look like those who ended up very sick right now in hospitals, maybe they are discharged at some point, they may need some physical therapy, they may have some long-term respiratory issues. What do you think is going to happen as a result of this?
You have severe symptoms such as coughing, temperature, then you are asked to, contact your doctor before going into the hospital, because the hospital system has been overburdened. What we are trying to do is to just make sure that all immigrants, including undocumented immigrants, seek the care that they need. And this is a critical time when immigrant families need to seek the care they need during this difficult time. And families can still see a doctor without health insurance.
Okay, and well, I think a lot of them are afraid that they're going to go and there's going to be some type of ICE agent around the corner who's going to grab them and maybe do something. But you're pretty much telling us that at this point, if they could, at the very least, they should know that they're entitled to this medical treatment.
Health facility is part of sensitive location, and their ICE is by law not allowed to enter those safe spaces, such as hospitals, schools, places of worship. So we are encouraging immigrant families to seek the care that they need.
Could you give us maybe a story of somebody that you know that has gone through this and maybe has not had the best outcome in terms of getting them the particular resources that they need from the government? I'm sure you deal with these people daily.
We are an umbrella organization and composed of 200 member organizations. So we ourselves don't do direct service. What we've been hearing from our member organizations, so for example, we have a member organization out in Sunset Park. They've been very effective in encouraging their community members to go seek care when they need it. I think that the challenge is that there's been a continual attack on immigrants at the federal level. So it's trying to combat that message and to combat that message to make sure that immigrant families and everyone knows that they need to seek their care when they need it. And so
I'm just wondering how you get the message out in an environment like we have now, where everybody's in their homes. It's not like they're out out socially where people can usually tell them, by the way, you're still entitled to this government-funded program. You're still entitled to proper medical care. Other than programs like this, where we're hoping they understand that and they're not going to just stay inside and be afraid to seek the medical care. I assume the organizations that you work with are really doing everything they can to get the word out. Am I correct?
Yes, absolutely. On our website, www.nyc.org, we have a COVID-19 resource page that is available in many different languages. And many of our member organizations, while they're working remotely, they are still closely knitted to their community members, and they're the ones who are providing frontline service. And all the services are in, multilingual resources. And in addition, our member organizations who are embedded in all their sort of immigrant community, locations, they communicate through Facebook, WeChat, all different types of social media, which is readily used. So I just want to, reiterate the fact that there are a lot of resources on our website as well as through our member organizations in the preferred language.
And could you give the website for anyone who's watching now, website or anything else that they can go to get this information?
Sure, it's www.nyic.org.
Okay. We don't have too much time left, but any tips or anything that you would want to give to our viewers who are watching now who are afraid to, go out there and get the medical treatment that they probably will need very soon, or at least a family member might need? What tips would you give them?
Immigrant families really should seek the care they need during this difficult time. It's really safe and smart to see a doctor if you need care. And we all play a role in keeping our community safe and healthy. And, your doctor is required to honor your right to privacy. You don't need to share any information about your immigration status. So unless you apply for Medicaid or other health coverage. And so you can still see a doctor without insurance. And this includes receiving care in any emergency room, community health centers, free clinics, and public hospitals. Just one last thing, testing, prevention, or care for coronavirus would not be used against immigrants in a public charge test.
All right, well, Mr. Chun, thank you very much. Senior Manager of Healthy Policy. It's a tough time for all of us. Stay safe, stay healthy, and hopefully we'll have you back in the studio the next time. I'll be in a suit, so this will look all a little different, okay?
Thank you.
All right, thanks again for being here.
In the midst of a worldwide crisis, a ray of hope here for the residents of Highbridge.
We have joined with the Highbridge Merchants Association, the Assemblywoman Latoya Joyner, and Phoenix Restaurant to embark on a partnership to provide free lunch meals to the residents here in Highbridge.
Gabriela Silverio is the program director here at Bridge Builders. She welcomed neighbors to the nonprofit located on 164th Street off Ogden Avenue, talked about the most recent organization partnering with them to provide for the community.
Food bank came the other 2 days, so we distributed 17 pallets of food. I think approximately close to 400 families. Yesterday they got gallons of milk, diapers, food essential, rice, vegetables.
This comes as the number of confirmed coronavirus cases across the globe is upwards of 500,000 and climbing, and the death toll above 23,000. With New York City seen as the new epicenter, a pause order was put in place across the state by Governor Cuomo, shutting down all non-essential businesses, with some of these owners now turning their efforts to help curb the alarming spread.
During this pandemic, where we've seen about 3,000 cases in the Bronx alone, about over 200 deaths in New York City alone, it's really alarming, and we know that families are living on fixed incomes, and access to food really is a challenge, particularly as many children are home now doing the remote learning. They tend to eat more when they're home more, and we need to make sure that families, particularly those that have small children, have access to free food.
Among those making Bridge Builders their resource is Daryl Thompson, who with his wife is raising their 3 grandchildren. While the news has generated deep concern, he shared he stands by his faith in God that all will be well.
We just got to take things day by day. We can't be worrying about what the next day or next week or month, because all we could do is add stress and anxiety, and then I could wind up in the hospital, and my wife could wind up in the hospital.
Along with Bridge Builders here, the Family Enrichment Center will also be providing meals. They are located at 266 East 165th Street. For more locations, you can go to council.nyc.gov. Vanessa Gibson. Here in Highbridge, Arlene Makoko for BronxNet.
Our BronxNet family wants to remind you to always wash your hands after coughing or sneezing, when caring for the sick, when hands are visibly dirty, after toilet use, before eating, before and after you prepare food, after handling animals or animal waste. Please stay safe and practice social distancing.
That's all for our show today under very difficult circumstances. I want to thank our viewers for watching. We will be back with another Today's Verdict in a week, probably also recording from home. But until then, stay safe, stay 6 feet away, and remember, know the law, know your options, reach a verdict. I'll see you next time.